Okay, good afternoon, everyone. Call the meeting to order. This is our weekly finance meeting of the commissioners. Today, March 8th, 2023, appointed hour of 1:30 p.m. having arrived. We'll get started here, and we open, of course, with an opportunity for public comments. Any wishing to address the Board of Commissioners? Not seeing anything. Do we have anyone online?
We have two individuals online.
Okay. Can we identify them?
Janelle Lemaster is on.
Okay, we'll start there. We have Janelle Lemaster is online. Ms. McMaster, did you wish to address the board? Give you a few seconds to unmute. What are we seeing?
No response from her yet. And then we have a Jen Wilt online as well.
Jen Wilton?
Wilt.
Wilt. Okay, we'll move on to Jen Wilt, and we'll circle back to everybody else. I know it takes a little time to sometimes unmute, but so Jen, Ms. Wilt, if you're interested in speaking to the board, now's your opportunity. Please unmute and address us. Give that a few seconds. Okay, no response there. So, okay, who else do we have on? I see one individual waiting. So,
that is one of the Perry County Commissioners,
okay.
Larry Riesinger.
Okay. Commissioner Riesinger, did you want to address us? Are you observing, or what would you like, sir?
I just want to say good afternoon, and this is my first meeting. I was just appointed to the Commissioner Board, replacing Gary Eby, who was in this committee. So again, just want to introduce myself, and I'll sit back and listen at this point.
Okay, very good. Welcome to the board, and welcome to our meeting as well. So looking forward to working with you in the future.
Thank you.
So with that, we'll circle back around. Anybody else on there? Anybody raised a hand or anything? So we have no other. All right. We'll move along then and move on to item 4, which is our topics of discussion for today. We have, I'm sorry. Yes, the minutes. And item 3 is the minutes of our meeting of March 1, 2023. Do we have a motion?
I make a motion to approve the minutes of March 1, 2023.
A second.
Okay, it's moved and seconded. If there's no further questions, all in favor indicate by saying aye.
Aye.
Motion carries. All right, now that moves us on to topics of discussion. We have several today. We're going to open with a very interesting topic to us, of course, is the discussion of the potential mental health fiscal year 2023 budget situation for both Perry and Cumberland counties. So Annie Strite, our joint director, is going to give us a little bit of information, right?
That's right.
Right, so it's yours.
All right. Thank you so much for the opportunity to come and to share what's happening from our perspective in the community mental health system. You know, first, I'm just going to say thank you for your support. The last couple of years certainly has been challenging, but I think as we look historically, there's been needs that we've had difficulty addressing actually for quite some time. So, you know, the job I have before today is to talk with you about what's happening in the mental health system. And unfortunately, I may need a battery replacement. There we go. Thank you.
Tighten it up.
So we've been talking about the last couple of years struggling to meet the needs in our community, as well as dealing with very tight funding. Our Board of Commissioners is aware that we've been flat funded for the last 12 years. This year specifically, we're facing the biggest proposed deficit that we've ever seen. We are believing that by the end of the fiscal year, June 30, we will have a $2.5 million deficit. We're struggling with lack of service availability to our county residents. And really, we're wanting to speak with you as well as to make sure that our community is aware that we need sustainable funding for mental health services, specifically county-based funded mental health services to meet the needs in our communities, both Cumberland and Perry counties. The demand and the cost of services continue to go up. And as a function of that, we're being forced or faced with the idea of needing to reduce services. And given our situation with the pandemic and the impact of the pandemic, that's not something we're taking lightly. Unfortunately, there are other county offices, other parts of the operations of the county that are negatively impacted by what's happening with the mental health system. I'm grateful for the folks behind me. They're all going to be talking just briefly about their operational areas and then the impact that's a ripple effect because of the mental health system's inability to really meet the needs of our community. Most of our services, especially those funded exclusively by county-based dollars, have waited. Our Board of Commissioners is aware that a large portion of the county mental health budget is used to support residential services for adults with serious mental illness. Some of our other largest costs are crisis intervention services, as well as student assistance. And I know I've shared this previously, we have staff that work in all of our schools in both Cumberland and Perry counties. And we see that as a valuable service, and we believe it's so important to continue that because we believe if we did a good job on the front side supporting families, it will reduce the need for long-standing, expensive mental health services further down the road. As a function of many factors, individuals are being sent to the emergency room, seen at the emergency room, and if they have been involved with the justice system at all, they're being arrested and taken to jail. And then some of that is because of the inability to meet the needs and have access to services quickly and efficiently. Staffing shortages has also been a significant need, and that's not just the mental health system. Truly, that's a human services delivery system issue right now, but it does cause us a lot of complexities and barriers to provide adequate services. We're grateful. Yesterday, Governor Shapiro gave us his budget proposal. So we are grateful for the proposed 20 million increase for mental health services. We need sustainable funds, long-term sustainable funds in order to meet the needs of our community. One of the things that we've been looking at is the funding formula that's used after the state receives the amount of dollars from the governor's budget, how those funds are allocated to counties. And the next slide, I'm going to get into that just a bit more, but we believe that funding formula needs to be assessed, reevaluated, simply because we don't think it's been looked at for many years. And with Cumberland County being the fastest growing county in the Commonwealth, we believe that's also part of the ripple effect that we're talking about. Some counties across the Commonwealth are shrinking in size, and then there's a good number of counties more toward the southeastern part of the state that are growing quickly. And we are dealing with the inequities of the funding formula. So the flat funding has negatively impacted our communities, and we really want to make sure that we have a community that's aware of it, as well as then how to address it. What might we want to do to try to make sure that people are aware of the need and then how to get it resolved. So we were just looking at Pennsylvania state data, and you can quickly see that we know this. Cumberland County is the fastest growing county in the Commonwealth. This is data that's only through 2020. If we look at population estimates through 2023, it's actually 13%. Cumberland County is growing just over 13%. And you can see, just as I referenced earlier, that lower portion, that southeastern section of the state is growing quickly, while other counties, their population is shrinking. I want to make sure that while we're asking that this funding formula is looked at, it's important that all counties have enough funds to be able to meet the needs of their community. You know, it's not taking one to give to another. It really needs to be sustainable, equitable funds for every county so that all of our counties can meet the needs of individuals with mental illness in our communities safely and efficiently.
Amy, can I do this?
Certainly.
In the northern counties that are, population is dropping significantly. What's happening Are they,
Sorry. go ahead.
are they coming under the same budget issues that we are, or is the fact that their population is decreasing, and they're okay?
It depends. Actually, the County Commissioners Association recently put out a survey to kind of evaluate that, and not all counties responded to that survey. There are some counties that indicated that they felt like they would have additional resources at the end of the fiscal year. There are many counties that are in the same situation as we are, feeling like there's not enough to adequately meet the needs of their community. And that's why it's such a critical issue right now, to make sure that the public is aware of where this is. We took a look at our funding, our allocation since 2010, as well as, and then I just overlaid it with our population growth. So you can quickly see what some of the issues are. Our population has grown significantly, and our allocation has changed very little, except for the spike in 2020. And I added to that the spike in 2020 was a function of our proposal to the Commonwealth. The American Civil Liberties Union filed a lawsuit against the Commonwealth about the amount of time it took to get people from jail into treatment. And that lawsuit was filed, I believe, in 2016. We proposed to develop a new program, which was funded and started in 2020. So that's that increase that you see there. I will point out, though, that even that program today, we received $1.125 million from the state to start that program. That program today is also operating in the red. Expenses are exceeding the amount that we received from the state to run the program. So you can quickly see where some of the needs are in terms of our population growth versus the allocation that we currently receive from the state. So increased demand and cost. Cumberland County is the fastest growing county in the state, and we're struggling to meet the needs, both in crisis intervention, our residential services, and the ability to be able to fully staff our services. With that, earlier I mentioned about the ripple effect across other operations in the county, and I'm grateful for other department heads from the county who are willing to come and just share a couple of points about how it's impacting their operations. So I'm going to ask Nikki if you could maybe speak a little bit.
Good morning, commissioners. So what I would say is that one of the biggest issues that Cumberland, all children and youth offices are receiving right now is an increase in complex cases. Those complex cases are a direct correlation to children unable to receive mental health services, physical health services. Annie touched on crisis intervention. We're getting a lot of that from crisis intervention. Children not able to even receive services to go home safely. And also children not able to even go into placement facilities because there are hardly any available to support them. Since I've been an administrator, I have had regular meetings with Annie. I will say the one benefit we have here is we have a great communication and a team that looks at all these issues, but her continuing to be flat funded, her continuing not to increase, just gives families not an opportunity to receive services, which will then end up in my system. When families are broken down, can't get the services they need, help, they do. They need other ways, and they come in through my system. So it's a direct impact to us. Thank you.
Thank you. We have Warden Shenk from Cumberland County Jail.
Good afternoon, commissioners. I just want to give you a little background. When an individual comes in the back door and he's going to be booked to process, part of that process is his medical assessment. And in that medical assessment, there's a mental health assessment done. It's a 4-point scale, A, B, C, D, C and D being our most severe mental health. I can tell you that in 2021, I had 1,953 commitments with an average population of 283. 34.7 were C's and 14.4 were D's, making a combined total of 49% of my population being some type of severe mental health issues. In 2022, I had 2,336 commitments with an average population of 339. Of that, 34.5% were C's, and 13.8 released for an addition was 48% last year. Again, that population, mental health, severe mental health is hindering us with the jump because of how much time that goes with them. One of my concerns is with Annie and her flat funding is she helps us with the continuity of care when they're being released. And if they have no place to go or they can't get us a place to go, these individuals reoffend when they get out, they break their probation and they come back to us. So I support her 100%. Thank you.
Thank you. Andy Benner from Juvenile Probation.
Thank you. Good afternoon, Commissioners. And in addition to Nikki's comments for children and youth, we struggle with complex cases as well. You know, one area I would say is with our residential placement, we've had to rely on more secure placements, which aren't always the most appropriate for some of the youth that are struggling with mental health concerns because we don't have the in-home services or the in-home community programming, as well as some of our less restrictive facilities to deal with those types of behaviors, and they end up in more restricted placements. You know, one thing that I would like to mention is, you know, as you're aware, some of the data that was shared a number of years ago with some of the Pennsylvania Youth Survey data showed a 40, I believe it was 42% in the 40% of youth that were struggling with depression or even having suicidal ideations among our high school population. That was of concern to our department. Around that time, we implemented the MAISY, which is a very short-term look at the Massachusetts Youth Survey. It's a short-term look, 30-day window of youth that come into our system. We implemented that. And again, this is just with our delinquent population. So there is a correlation. Obviously, we're looking at the high school population versus our delinquent population. But since that time, we've identified that 23% of those youth that we score coming in are scoring in a critical case range, meaning 23% are at some type of critical level upon arrival in our department, that then we're looking for services to either reach out to mental health to get services and other options to provide treatment to those families. In addition to that, the suicidal ideation, we have 13% of our youth that are showing critical case levels of having or warning levels of potential suicide thoughts and ideations. So that's, you know, we have processes put in place for that as well, where we're having conversations with families, reaching out for services to help streamline those youth to get them the service they need. In addition to that, we've also implemented our CTS, which is our child trauma screen that works with youth looking at exposure to trauma as well as systematic exposure or showing systematic behaviors. Since we've implemented that, we've completed about 459 screens since we put that in place of all our youth coming in. 19, close to 20% of our youth are scoring at levels that exceed a certain level where we're reaching out for further evaluation or for their services. Based on these factors, we've had staff from our mental health department participate in meetings with our department on a regular basis, even spend time in our office for a period of time for 1 day a week, and really work in tandem with our mental health department to try and provide adequate service for these youth that we're identifying that have significant needs, specifically when it comes to our delinquent youth, because we know that if we cannot overcome some of these risk concerns, that has an impact on future recidivism. So, which is one of our overall goals of our juvenile justice system. Thank you.
Then finally, we have Bob Shively from the Department of Public Safety.
So unfortunately, a lot of the people, whenever they are in crisis, need to call 911 for either ambulance or some type of support. So we try and track those stats through our protocols. We specifically track the psychiatric or behavioral problems. So whether it's an EMS for some type of mental health issue or the police type protocols for behavioral issues. But that's just a small sliver. But just tracking those type protocols specifically, we're seeing about a 30% increase. So over the last 3-4 years, so about 10% a year. So if you go back to about 2019, we were right about 800 calls per year. In 2022, we were at about 1,230. So, but almost year to year, 100 more calls per year. So, I mean, we're definitely seeing the increase in additional pressure. With that, certainly a change in the culture of how can we handle those calls better. I know we've been working with Annie on different options for additional training for law enforcement, co-responder, training to be able to recognize those in crisis, Currently we have some gaps in what services can we provide in lieu of just, arresting people and taking them to prison. So I think, with additional funding and things like that, being able to provide mental health crisis response teams and being able to provide people with additional support that would be, more supportive versus just taking them to jail and then kind of repeating the process. And as we've talked about in some of our planning meetings, whether you pay that as an investment up front or you pay that in a reoccurring cycle for incarceration and things like that, and the services from all the departments, I think, it probably matches out pretty equal. So that's all I have for now.
I think overall, just as all of these folks have pointed out, we have a very strong collaboration with all of our departments. Bob mentioned the 30% increase in calls that they are coding as psychiatric, and compared to a 4% overall call volume increase. So across Cumberland County, there's about a 4% call volume increase, and about 30% of those calls are identified as psychiatric or behavioral health in nature. To me, that very clearly speaks to unmet need and how we can do a better job. It certainly isn't that we're not interested or willing. And then with Andy's department, we have a staff member who is our cross systems coordinator, and she works very closely with juvenile probation as well as children and youth. And I believe those kinds of collaborations have helped us, honestly, to operate incredibly efficiently, as well as to strengthen the collaboration that happens between our departments. And similarly with Warden Shenk, we pay for part of a position at the jail. We also have a forensic case manager. We've done, I think, some innovative thinking around data and capturing data. We now have an interface between the county's mental health database and the jail's database. So anytime a person is arrested that we've known in the county mental health system, it generates an email. So we know immediately when that occurs, so we can proactively step in and offer support. So I feel like in the last couple of years, in spite of the barriers and the challenges we faced, we've done good work to try to make sure we're working hard to support our community. And then, Nikki mentioned specifically about crisis intervention. We've had quite a number of times where we've met to talk about some of the challenging cases, because really we're really wanting to support families in our community and the struggles that they've faced getting services for their children. And I think all of us are invested in making our community the best community we can. And so for us, this negative ripple effect it matters. And so whatever we can do to make sure our community is aware, making sure that our legislators are aware, and hopefully this has a positive impact then on our budget specifically, so that we can serve our communities well. I will also point out that Penn State Hershey Medical or Holy Spirit is now a 988 call center. That happened in August, I believe. So, they're also identified as one of the 988 call centers across the Commonwealth. So they're taking the 988 calls. Again, I think it speaks well of our community and the investment that we've made to try to support our community with excellence. Do you have any questions? I will talk briefly about the plan that we have.
I do have one question. So, and I think echoing your comments, everybody should be commended for the all hands on deck kind of approach to dealing with what has been nothing short of a crisis. Most overused term in government, by the way. So, but here's my question. So I heard two things that are driving these caseloads. I heard about our population growth, which is very clearly a long-term trend that's been in place for a good while, probably going to remain somewhat in place for a good while. We also heard about the pandemic-driven spike in need. So my question for you, I'm not looking for a hard percentage of how much of the total is this one or that one, but do we see this being somewhat temporary, if I can use that term, related to the pandemic? Is this going to pass, or is this much more driven by the population increase and a problem that is here to stay?
I'm going to say both. I've participated in some disaster recovery kinds of seminars as well as leadership training, and there is definitely traditionally a spike after a community disaster. So this public health emergency certainly would be categorized as a disaster. and the impact of that. So, typically there is a spike and then it does taper off. I would be uncomfortable kind of saying specifically how much of that is related to the pandemic versus our population growth. I think we currently, as a nation, are grappling with psychiatric physician shortages, as well as then treatment provider shortages. And Pennsylvania falls in line with so many other communities. So we definitely, there are areas that need to be worked on.
Since you brought that up, let me just address that very quickly. The workforce issue of where we don't have people to deliver these services to. So, that begs the question of, is this a money problem or is it a, people-driven problem? Again, it's going to be both, I realize. So, but my question is the dollar side of it simply that those positions aren't competitive, or there's simply not people available to fill those positions, which is a situation we're encountering. Cumberland already had one of the lowest unemployment rates in Pennsylvania. So this has just been magnified, amplified through the current workforce crisis. So if there's money, are there going to be people there to do it or not?
I would like to say yes. I'm not sure, to be honest. I think workforce development, we've been meeting with colleges to try to spur interest. Anytime we're invited to do any sort of training with any of our local colleges, we always do that just to try to, spur the interest and make sure that students have an awareness that this is a rewarding career. And we believe in, mission-oriented focus. So, but I definitely agree with you that it's a double-edged sword. I hope that the fiscal resources are there because obviously people need to support their families and they're not going to want to go into a career that is exhausting physically as well as then doesn't pay very well.
Annie, the $20 million that's being proposed as a budget increase, and under the current formula with 67 counties in the state, that doesn't sound like a lot.
I agree. I believe last year Governor Wolf's budget proposed 36 million, and then ultimately it didn't come through.
Right.
In 2010, I believe the cut that we received in the Corbett administration was more than that across the Commonwealth. And ultimately the impact for us back then was about $1.2 million. And that was you can see it on the one slide. So for us, we've been struggling to meet the needs and making some cuts, trying to honestly do the least amount of damage whenever we make those cuts. And I'm concerned about the future. So that kind of leads me into the plan. We have formed a stakeholder group, which is comprised of family members, people who have received county funded services, some of our largest providers who have a strong awareness of the funding in the county, the funding streams in the county, as well as our staff. And we're going to be taking some time to look at our budget, look at how the county is spending its funds, and then to ultimately make some recommendations. Are there things that we could perhaps decrease and do as little damage as possible to continue to support our community, with the hope that the governor's budget is approved and that we will receive some additional resources. We're also going to be planning some town hall meetings in the very near future. I did see earlier today that April the 11th is the Department of Human Services budget hearings. So we want to be sure that we're meeting with the community as much as possible. Really, I'm interested in hearing success stories and people who are happy about services, as well as people who have struggled and some of the barriers that they've experienced, because ultimately that's what gets people's attention regarding the needs. And then we're going to be hoping to meet with our decision makers. I've already reached out to Deputy Secretary Jen Smith, Acting Deputy Secretary Jen Smith, to see if we might be able to meet with her. And then our hope would be that we would be able to meet with our local legislators as well, to talk with them about the needs in our communities. And we have people who are willing to share their stories about some of the struggles that they've experienced getting services for loved ones, and even personal stories about themselves struggling with services. So that's our plan. In the very near future, we're going to be needing to come back and meet with our Board of Commissioners again to talk about the recommendations and then ultimately make some decisions. And likely we'll have to make those decisions before the governor's budget is approved. Because with our deficit looking like it's 2.5 million, we will need to notify our providers about changes in contracts and the amounts of cuts that we may need to make in advance of their contracts. So, we'll have to be scheduling that in the very near future, I think in the next couple of weeks, probably.
Just one other question.
Sure.
Going back to something you said earlier when we were looking at the population map and you're saying, I think I heard you say that we don't want to take money from anybody else, but realistically, this formula, funding formula has been a bugaboo for a very long time. We've not been able to crack that. So if you had a Forest County population down 9.6, Susquehanna down 11.4, Sullivan down 9.1, Cameron down 10.6, and at the same time that we're up 10.2, why would we not ask for a flexible system that allows money to flow where the need is? These are significant, and they're not all uniform, but these are some significant declines in some of these counties. And it raises the question, are they getting too much? The more fundamental question is just one of the fair share.
Mm-hmm.
So would we not entertain the idea that flexible funding formula would be potentially part of the solution?
I do believe that's an important part of this equation, that it would be set up in a way that would be equitable for all of the counties. And along with that, these percentages are just that, they're percentages. We don't know how many are class 3 counties, how many are class 6 counties. So their populations may be smaller than ours. And the flip side is, if you just look at even like Chester County, for example, that's a larger county, still class 3 county, but their population is nearing that 500,000, so that in terms of number of lives in the community that's what some of the key differences are with those statistics. So I agree with you that really we need something that's flexible and equitable to make sure that all of our communities have what they need to support their family.
It would seem to be more politically doable than the idea of just nobody loses anything, but we need more.
Right.
As you know, the legislature is not inclined toward that direction, generally speaking. So, so when was the latest iteration of the funding formula determined? Do we know that?
I do not know that.
But it has not changed recently.
It has not changed for years, I don't believe.
Okay, understand as well. Thank you.
So, Annie, as you're talking about this and you're saying today that, there will be another conversation with this Board of Commissioners who I believe this board has its work cut out for us so that we never let this happen. It is my personal opinion that we can never let these kinds of cuts happen in terms of mental health funding because of that negative ripple effect. So when I think about you coming here and sitting in front of the three of us and saying, okay, who aren't we going to help? What's the cost of not helping? That's the number I want. I want to know what it costs public safety if we don't take care of this measure, if we don't take care of this funding. What does it, I want to know what it costs. I'd like to know from our local police officers what it costs. I'd like to know what it really costs the county and the taxpayers of Cumberland County for us to not have this money. I'd like to know what juvenile probation has to say about that. I'd like to know what the prison has to say about that. And I'd like to know what children and youth has to say about that. We are an instrumentality, sometimes unfortunately, of state government. Mm-hmm. And I hear this over and over again in this county. You can't have that. And this is not one of the things where we can say, you can't have that. Just the humanity alone of it is very concerning. And the ripple effect to everyone is very concerning. And the long-term ripple effect to the taxpayer is very concerning. But notice I said that third in my concerns, okay? I am very interested in the question about would appropriate, adequate and equitable funding of mental health in Cumberland County, how can that also assist to have adequate and equitable employees to do the work, across? I'm very interested in that. I'm tremendously concerned about this. One of the things that we do in this county is serve people, and this will be such a lack of service to so many people. It will be, I think, catastrophic.
I agree with you. It's definitely not something we're taking lightly. I really don't like even the idea of making cuts. I know that the last couple of years, we've seen a lot of families struggling. And I know our children's staff especially have seen so many families struggling in the work in schools. And, you know, I feel like we've, again, done good work in the schools, and really we've just started the elementary student assistance program just a couple of years ago. And every school now is asking to do more. And we're struggling with staffing just like many of our providers. And so we've had the staff spread very thin and still meeting the needs of the community and working incredibly hard.
So this brings me to another follow-up question, because I watched as much as I could of the governor's address yesterday until my computer threw me out of it. But in reading then CCAP's generalization today of the budget address, one of the things that they keyed in on was mental health funding. And they talked about the $20 million. And I think Commissioner DiFilippo raised an excellent question when he said, $20 million, 67 counties, how's that going to pan out? The other thing that I really paid attention to yesterday was the money that is in the budget to go to school mental health support. And I am interested in the interplay between our budget and what that potential, if that is passed in the budget, what does that potentially do to ours? It seems it could help.
One would hope.
Yes.
We're going to be reaching out to our school districts to see how that might look.
Okay. I mean, I think these are important things to consider as we move forward with how to handle this, but certainly this board has its work cut out for it. This is one of those, I'm going to call it a legacy issue. Yeah.
Have any other questions?
Yeah.
I really appreciate this and the breakdown of counties and showing what that really looks like. And most certainly Cumberland County's delegation. We need to have this conversation with them also.
Thank you.
Any other questions for any of our esteemed guests? Okay, thank you very much.
Thank you.
Moving along to our second bullet point. Also, let some of our valued staff get back to work.
Sorry.
Reasonably settled now, so why don't we move on to our second bullet point. This is the letter of support regarding an application for FAA Part 137 certificate, Swift Aeroseed LLC.
Yes, commissioners, recently, well, actually, it was a few months ago, the corn planters seminar held by our conservation district. We had a company come out to give a demonstration on an aerial drone-like device that would do cover crop planting. And the demonstration was very good. There were a lot of farmers interested in getting more information on this process. And the process of using a drone saves money for the farmer. They don't have to use their equipment, don't have to, spend fuel to run their equipment to plant the cover crop. So I was contacted actually through Janet at Kadick, and this gentleman, his name is Bill Chain, had contacted her about the issue, possibly getting some grant money, etc. And that's a separate issue. But the problem is right now, and this recently came up, is that the FAA requires a certificate for these devices to operate legally. It shouldn't be an issue, but as I was told by Mr. Chain, is that the FAA is really behind in processing these applications. Our conservation district has written a letter of support, and they asked that the board of commissioners could do so. And that was my request I had made about a week or so ago. And the letter here in front of us really indicates just our support in asking the FAA consider their application. My request is for your approval.
I have a question on this. So this is all aimed at the approval of a single provider. It mentions the need for the private sector to work with the local governments, which I would not disagree with, but one of the benefits of private sector involvement is that it gives you, there's competition involved. You might have a better provider, you might get a cheaper price, any number of benefits, gives you more flexibility. So I'm a little baffled about why we were looking at a single source letter of support here, rather than maybe just advocating for expeditious approval of the licensing portion that could apply to any potential provider of this. Are there other potential providers of this?
Well, this is the only outfit that we know of at the moment, and they are located here in Cumberland County. I would not have an issue adding an additional sentence that would say that. So you're saying, Gary, not make it specific to this company?
Yeah, I think that's unless we know more, if they're the only option or whatever.
They are right now.
The only one in Cumberland County, or the only one doing this?
Yeah.
Because none of that's addressed. So I would, I'd be a little hesitant to sign on to something that, has the appearance of a sweetheart deal, for lack of a better term. If there's potentially other providers out there. I mean, we bid things all the time. Does staff know anything more about this?
The only thing I can tell you is that this organization, Aeroseed, did work with our conservation district to do a pilot program. I know that is not definitive proof that they are the only organization like this, providing this type of a service. But I do believe they were given an exemption to that certificate because they were doing the pilot program. We can certainly provide more details. You can reach out and get some.
They're grounded until they get that
Yes.
certificate. And any outfit that would want to do this anywhere would have to get that certificate. So the more I think about it, this is really just a letter of support for this outfit to expedite their request.
What's the seasonal constraints on this? Is there a time frame that this has to take place in?
I'm not sure what their lead time is to move forward to the next phase of their project, but cover crops are typically after the growing season is when the cover crops are where the seeds are planted, if you will. So, but again, I don't know how many months they need for lead time once the certificate is provided to go into production or any other step of the organization, but I'm certainly happy to get some answers for you.
It's apparently going to take a while to get the certificate. And that's why they want to get enough supports to hopefully expedite time.
Carl popped on.
Oh, great. Yeah,
there
I
it is.
can provide some details.
Yeah, I
Hey,
can
Carl.
just say that, the time frame that they'd like to get cover crop seeded would be August, September time frame. So there is some time for them to get approval and everything. But I think even in summertime, they seeded some cover crop in midsummer when some wheat and barley was coming off. So I think, but late summer is the time frame they'd like to be up and running.
Carl, how long ago did they make the request for the FAA Part 137 certificate?
I don't know the exact time frame. Bill just approached us I would say probably in December sometime, he first approached us asking for, support and everything. But so my guess, it was late fall, early winter, my guess.
And so is this just hung up somewhere at the FAA that no one's looking at it, or is this part of a bigger application process?
My understanding is, they had got approval, kind of experimental type last fall. And the way Bill talked, some different people at the FAA looked at it differently and felt that it needed, a different type of approval. So that's why they're grounded for now. It's definitely some innovative technology. I was there when they first went on the Ickes farm to first, spread the cover crop. And, there's some glitches, obviously, because it's experimental and they're learning as they go. But by the end of the fall, they were able to work out some wrinkles, and it was working much more effectively and smoothly by the end of the summer. So they learned a lot as they went.
So is this their original, Carl, I'm hoping you know this. Is this their original request for the certificate, or is this maybe an amended request based on the FAA's feedback?
I'm not sure. I don't know all those intimate details. I'm not really sure.
Carl, who's paying for this?
What's that?
Who's paying for this? So the farms get assessed a fee for the use of this, or?
Yeah, now the experiment in the fall, the conservation district contributed, I don't know, $400 or $500 to pay for the actual seed for it to be done experimentally. But for going in the future, it'd be the farmer that would pay the company, for, the seed and to work to get it done. So it'd be the farmer paying the company.
I would think it would be in their interest too to make sure that it's open to competition if there are competitors. So we just don't know anything about whether there are competitors.
Yeah, I don't know of any. I can tell you this, I hunt in Illinois. This technology is in that area of Illinois because of the corn is taken off for grain out there, and so they use the drone and airplane technology to spread cover crop while the corn is still growing in Illinois. So, but I don't know of any around this area.
Carl, is the intent of this letter just to get this certificate off someone's desk?
I think so. I think it's just to expedite it so, they could hopefully get things up and running again by late summer, because if it goes on to late or early into the fall or mid-fall, then it's kind of too late to get that cover crop out there. So, in order for them to really get some work done this fall, they need to get approval so they can get off the ground.
Carl, Conservation District has already sent their letter of support.
Correct.
Okay. And if there are more organizations that do this, I'm sure you'll hear about it, correct?
Yeah, I'm sure we would.
Commissioners, Carl mentioned being there when they applied the cover crop seeds to a farm. We do have a video to show you if you are interested in seeing it, that shows in operation what this drone looks like.
I think that was distributed to everybody. So that's fine. I don't have any more questions. So
based on that information, I'm okay with the letter.
all right.
I'll make a motion that we approve the letter of support as presented, expediting an application for an F8A Part 137 certificate for Aeroseed LLC.
I second.
Okay, it's moved and seconded. There's no further questions. Call the vote. All in favor indicate by saying aye.
Aye.
Aye. Motion carries.
Thank you, folks.
Okay, it moves us on to discussion on financial employment trends dashboard. Brandon Yeager is Goodhart as the speakers here. I see board here, so gentlemen, whenever you're ready.
New commissioners. So we're going to be starting off with talking about the financial and employment trends dashboard. It would be the one page that you had received showing graphs. And this is part of the fiscal growth and trends team. Created this in order to try to find a way to provide the commissioners with various information so we can tell if something's heading the right way or something's heading the wrong way.
And for those who are on Zoom, just introducing, I'm Derek Goodhart, work in Human Resources.
And I'm Brandon Yeager of the Finance Office. So we're going to be starting off talking about salary and benefits. First chart is showing the general fund salary costs. This is showing the year-over-year amounts as well from 2017 to 2022, as well as the increase year-over-year. And as I move to slide 4, those increases can be attributed to wage scale increases, performance increases, additional positions, filling of positions, and department reorganizations. And on to slide 5 is the percentage salary changes. So these salary changes are, again, these are just for county employees that are non-union and non-elected officials. And includes wage scale increases and performance increases they would have received for those years. On slide 7, we have the actuarial determined contribution for retirement from 2017, including up to the estimate of 2023. And that's for the total county actuarial determined contribution. And just to note that 2018 had a one-time adjustment due to an actuarial correction. And then I'm going to turn it over to Derek to talk about staffing.
Hey, before you do that, I'm sorry. The salary percentage increases are running through 2022. I'm assuming that in 2023, nothing, all else being the same, that figure would come down due to the fact that we no longer have a nursing home. Is that correct?
For the general fund salary, for the, no, because this excludes the
Vince, this is the overall percentage that our non-union employees receive. So this is just showing you what they all received each year as a percentage total.
Right.
It's my understanding that the nursing home numbers wouldn't be any factor
Okay.
in this particular figure.
This one is just general fund.
Dana has her hand up, I think she's.
I think Brandon covered it. It's just the general fund and it's the actual salaries chart. So it includes full-time, part-time, overtime,
Union.
union, non-union. It's everybody in the general fund only.
Thank you.
Commissioner, moving to staffing. First chart you'll see here related to positions, the vacant versus filled positions. You'll note on the far right of this chart, those percentages from 90 to 94 correlate with the yellow line of the positions that have been filled, the percentage, and the numbers on the left correlate with the bar chart. It's important to keep in mind, moving to the next slide, one of our HR goals this year is to address vacant positions within the county. It's important to note that intern positions, they do stay vacant more frequently, and many of our departments have permanent temporary positions, children and youth, prison, public safety for staffing. But one of my goals is to look at our current procedures and policies related to vacant positions and suggest or potentially propose new policies or changes to them so that we can minimize our vacant positions or get them filled or allow them to not stay on the complement for a longer period of time, which is what is currently happening. Moving to the next chart, this shows applications that we receive versus hires. It's important to note on this chart, the far right correlates with the number of new hires with the blue line. On the far left is the green bar chart. As noted on the chart, it's important to note that the nursing home data does include from 2017 to 2021 in our old applicant tracking system. We were not able to pull that data out. The other thing it's important to note from 2017 to 2021, those are quarterly averages. And then you can see 2022, those quarters are broken out for you. Some recruitment initiatives from HR, our recent new county internship, countywide career exploration policy approved by the board. We do have our high school students that have been in 10 of our county departments here in the meeting today. So some initiatives, again, ensuring that our departments and offices understand what we have to offer with that policy. Referral bonuses, specifically with public safety and children and youth. When a current employee refers someone and they get a bonus after a defined period of time. One of my goals is countywide recruitment plan, putting together a formal document to kind of capture all the recruitment options that we have at our disposal. And our total compensation study, which is currently being worked on. On the flip side of that is equally important retention. One of our goals this year is to update our exit interview process, make it a more electronic, streamlined process so we can take that data and analyze it better. Doing department stay interviews. I know Public Safety Director Bob has done those at Public Safety and Children and Youth, but making sure other departments know that that is something they can consider as well. Our 2022 employee engagement survey, continue to take that data and making suggestions to the board on potential changes on behalf of the employees. Also in correlation with our total compensation study. Two other goals, career pathing, so that employees kind of have an understanding of how they can get from one position in the county to another position, and having HRs help and support on that. And a mentorship program for both new hires when coming on board, as well as how to get an employee from one position to another to hopefully help that they will retain and grow with Cumberland County. The final chart with staffing that I have for you is our average quarterly turnover report. Again, from 2017 to 2021, those are the quarterly averages. 2022 is broken out by each quarter. The blue line obviously represents the averages. You can see on the next slide that this shows our county turnover rates in comparison to government sector as defined by the Bureau of Labor and Statistics. And you'll note that in both 2021 and 2022, our averages and actuals were below that of what was reported by the Bureau of Labor and Statistics government.
This was a complete aggregation of all governmental.
Correct.
Local, state.
Yes.
Schools, everything.
Correct. Yes.
Derek, we do have to have each private sector.
Not at my disposal, Vince, but certainly can be pulled.
Thank you.
Now moving on to economic factors. The first one that we have is the tax base, and showing year over year from 2012 to 2022. And the left axis is for the orange bar charts, and the right axis showing the percentage increase year to year with the light orange line. And even though a year such as 2016, there was a decrease, it's not a decrease in a tax base, it just increased less than the previous year. And all of those percentage increases are between 1% and 2%. It's a very small range.
It's basically just a measure between fastest growth and slowing of growth.
Yes. Moving on to slide 20, we have the consumer price index. Not something that we have any control over, but something that greatly impacts us. Since 1996, it's been around 2 to 3% typically, but the past 2 years, it's been up at 7% and 6.5%. Finally, unemployment rate, showing Cumberland County compared to Pennsylvania and the national unemployment rate, where Cumberland County outperformed Pennsylvania and the national rate throughout the entirety of those 6 years.
Commissioners, as Brandon stated at the beginning of our presentation, a lot of work behind the scenes went into putting together. Kudos to Brandon on putting the dashboard together. It is our hope to update this data quarterly and bringing it to you all, that you can use this information when making county decisions. Certainly, if there's any questions or feedback that you have, we're open to that.
Very good.
Thank you so much.
No. I guess the one question I have is related to the question I asked of aggregation of all those governmental bodies. Is there one category that maybe we align closer to, provide a more accurate side by side?
It's possible, Gary. I don't have that information, but I can take that feedback back for the next time we present. Thank you.
Good, thank you.
All right, so I'm now going to be discussing the 2022 year-end general fund balance. And it is just a quick overview of the fund balance, where it ended and how it's changed since 21 and compared to our projections. And before we get too much into the numbers, I want to state that when I sent the presentation over Friday, since that time, there had to be one real estate adjustment for $50,000. So these numbers are before the $50,000 adjustment. That's going to increase real estate tax revenue and increase fund balance. On slide 2, Cumberland County ended 22 with a $35 million unassigned fund balance. And again, that's before the 50,000. This would be 131 days of fund balance. And overall, it was a fund balance decrease of $2 million. Slide 3, some of the major changes since our projection. These have offsetting revenue and expenses, so it doesn't impact fund balance, but they're major. Some of them are major dollar amounts and important, just to note. On the slide 4, the changes from the projections that do impact our fund balance, which ended up being $1.8 million more than we had projected, is real estate taxes increased $224,000 due to the timing of collections. A large amount of money came in December. Interest revenues increased $386,000 due to the rapidly increasing interest rates. Capital expenses were a little below what we had projected at $286,000. And subsidy had increased $1.7 million almost, just due to the additional need that MH had and Children and Youth Services. And then that was offset with a transfer from committed fund balance of $2.6 million for the county grant program. Moving on to slide 5, the changes from the 2021 fund balance. Actual ending fund balance again is about $2 million less than it was in 2021. This is due to the real estate taxes increasing $933,000 due to natural growth and collections. Interest rates again increasing significantly from 2021 to increase our revenues $755,000. And we also had more cash available to invest due to receiving all of the art money. And then,
Can I interrupt you just for a second? This note. Am I reading this correctly, that interest revenue increased 331%?
yes,
Okay.
it was like $200,000 in 2021, roughly.
Okay.
So, and then it ended almost $1 million in 2022. And court costs, fees, revenue decreased $490,000. That's due to no bend forms being issued until the end of June of 22, and people having less money in 22 to pay. There wasn't all the extra stimuluses in 22 as there were in 21, as well as more of the outstanding fines being paid in full. So there's less outstanding to collect. Salaries increased 2.2 million and benefits increased 400,000. This is due to the prison receiving a $2 an hour increase for their positions, as well as filling a few positions, and the VA and public defender increase due to the rework of the attorney salary increases. And then again, subsidy increase a little bit due to MH's increases offset with a public safety decrease in subsidy and the nursing home decrease in subsidy. And then I think the adjustments to fund balance, committed fund balance increased 39 million. That's due to the county grant program, 31 million, and the Claremont proceeds of 7 million. And that money is committed until the board determines where it's to be allocated. Assigned fund balance increased $3 million due to the Claremont proceeds increasing and being assigned for future expenses, and the Hornbaker note being paid off of 700,000. And restricted increase just due to additional increase 700,000 due to 580,000 additional farmland fund balance. Are there any questions or anything? Thank you.
Was just item 5, which is other business.
Sure.
Entertain a motion for adjournment then.
Move to adjourn.
Stand adjourned. Thank you all.